Welcome to Anatara Medicine Podcast. Today, I'm your host, Dr. Mohammed Mansour. I'm a naturopathic doctor. We have a very special guest today in the field of complex chronic illness, specifically in the field of drainage and lymphatic drainage. I feel like it's an often overlooked topic when treating complex chronic illness, and that can range from Lyme, Bartonella, Biotoxin illness, mold, Mycotoxin illness, mast cell activation syndrome, dysautonomia. It's a wide spectrum. Some in the field call it MSIDS, or multiple systemic infectious disease syndrome. It goes by many names and many hats. Many pathogens are involved, and today in the pandemic area of COVID, even post-COVID syndrome, long hauler syndrome falls into this category of people we may be able to help. And I think we have one of the most cutting edge top experts in the field. Dr. Ginger Nash is here. I like to call her one of my personal mentors. She was one of my professors back in school, in naturopathic medical school. She's one of the pioneers in this field of drainage. Her work focuses on healthy elimination as a foundation for immune, hormonal, nervous system health. And that elimination, of course, today is going to be the focus of our talk through drainage and how to improve lymphatics and open up your channels of elimination. She graduated from the National College of Naturopathic Medicine, which is now known as NUNM in Portland, Oregon. And she's maintaining an active medical practice, seeing thousands of patients, addressing complex chronic illness in the field of women's health in particular, and in chronic immune dysfunction. She's been in practice for over 15 years now, I could say.
23 years.
Whoa, 23. Wow, that's even more.
A lot longer than 15.
Okay. So over 15 and definitely more than 20. And she's been dedicated to naturopathic medicine and promoting this field and advancing this field. And I feel that one of the most exciting things that are coming up is she's going to be offering a course in lymphatic drainage that's going to be upcoming hopefully in the early months of 2023, which I'm very excited for. And I'd like, Dr. Nash, you can take it away and maybe give us a little bit of background on what lymphatic drainage is and how you got into it.
Yeah. So, my work with drainage really encompasses the whole body, all the organ systems. So lymphatics is something that, as you already mentioned, that has been overlooked quite a bit in mainstream medicine. But really, any organ system of the body, any tissue, any cell can be improved. The function can be improved by helping the body eliminate effectively, and working with these concepts of homotoxicology and post infectious syndrome and drainage, for lack of a better shorthand. That's kind of what we call it, is just drainage. But it's a lot nicer in French, drainage. So yeah, one of my main teachers was Dr. Gerard Gagnon. He was a French medical doctor and homeopath. And I began studying with him, ironically, the summer after I graduated from NCNM, which was 1998. So as I was studying for boards, I was also having my eyes really opened to a different way to use some of the modalities that we had learned about in school. I come from a history of medicine background. So I was always interested in the way different cultures, different periods of time had understood the body and its complexity. And I understood that diagnoses were really just ways to try to organize and understand the magnificent complexity of the human body and human physiology. So I was always interested in sort of these gray areas of like, well, what does make a disease? What makes health? What makes disease? And how do different people's throughout time and across the globe understand the way the body functions, differently. So that kind of led me sort of naturally into a curiosity about energetic medicine and why I didn't really want to go to traditional medical school, but I was more interested in a holistic philosophy and looking at the body in ways that weren't necessarily explained with purely mechanistic terms. So that summer, a friend of mine convinced me to fly to New York, even though I was broke as a joke at the time, living in Portland, Oregon, as we all were during med
All
school.
of us. I hear you.
I drove a truck that I bought off a friend for $200.
Nice.
So
Nice. I got mine off
terrible.
Craigslist, so I know.
Yeah. So I flew to New York, and Dr. Gagnon really put things immediately into a framework that just was like, wow, yes, this is where I'm coming from. And he would talk about it sometimes as a difference between a unicist and a pluralist. And the unicist sort of way of looking at things was kind of how we were taught homeopathy, and sometimes referred to as constitutional or
classical.
Thank you.
Classical homeopathy.
Classical homeopathy, where you just use one single substance that addresses all the different aspects of the being and aspects of physiology. And that never really made a whole lot of sense to me. I think the way I think is more in the pluralistic line. And, I recognize so quickly, right? And especially now, 23 years after I'm out of school, and, every year we get more complex disease. We have more exposures. We have more pathogens. This pandemic is obviously the most world famous, but there's been other pandemics and they're coming with more frequency. The body is exposed to far more toxins in the environment, et cetera, et cetera. So people aren't getting sick from just one thing. And therefore, I believe our approach in getting people well really needs to encompass a lot of different types of modalities. And so the type of homeopathy that I learned from Dr. Gagnon was really a French system, a pluralistic system, where you use what I call complex homeopathics. So it's not just taking all the homeopathic remedies that would cover, say, headaches, of which there are hundreds, and throwing them all into one formula and hoping that you get the right remedy. It's really looking at using the concept of homeopathy, which is an energetic concept of dilution and potentization of these substances, to help address organ system imbalances. So using things like plants and minerals and metals and potentially isopathics, and we can definitely get into that because I'm using a lot of low dose immunotherapy in my practice now, which is basically almost like an isopathic approach. Well, it is an isopathic approach. So it just made a lot of sense that there needed to be a more, in my opinion, complex approach to helping complex illness, right? And I know you get this too. I mean, I've supervised you way back in the day, and what you're doing, and I'm aware of what you're doing now. And that, it's not, there's no silver bullet. There's no.
No, but I feel like what you're explaining is almost like the glue. It's almost like there's this missing link in terms of therapies that are commonly used now, even IV therapy, and ozone and other of the more high impact therapies that people are gravitating towards. There seems to be a missing link in why those therapies don't always give the best return. I think that's why you're such an important expert in the field to discuss why this is happening, what makes your approach in drainage different. There are a lot of people using different companies for, homeopathic drainage. I feel there's some that are more cookie cutter. They kind of just give everybody the same stuff and hope that it sticks. You seem to have a more personalized approach to this, and you've hinted at low dose immunotherapy as well. What makes your approach different in terms of other things that are out there. There's companies like Desbio, Picana. There's a lot of people doing drainage.
Funda, Physica, yeah. And I taught for Soroil for over a dozen years. So I taught the undinumbered system for many years. I'm really comfortable using that system. I switched to using more of the Physica Energetics product line. They have more of a focus on the extracellular matrix, the mesenchyme, and the lymphatics. So we can talk more about that for sure. And I will get back to that. But yeah, I've also, I pick and choose, and I'm not beholden to any one system. And I've actually found that for certain complaints and for certain issues, different remedies from different companies work best, which is nice. So that gives me kind of a facile approach to, picking and choosing what system, but that takes a lot of time and effort. And I think there are ways that you can, really, if you get the overall philosophy and get what we're trying to do, then you can really use any system more effectively. Not even just, drainage, but just the concepts of what I'm talking about, which really comes out of homotoxicology and some of the European work with Dr. Reckewig and other people, that really takes into consideration the way the body is eliminating. And that's the whole science of emunctorology. There's 3 main organs of emunctories that are called the primary emunctories: the liver, which dumps into the gut, the lungs, and the kidney. So, first and foremost, we want to think about helping the body's normal, natural physiology work optimally before we come in with some of those more, if you will, aggressive treatment modalities like you're talking about. Like, yes, things like ozone can be incredibly beneficial, but if you've got a system that isn't eliminating or you're not draining properly, you can sometimes make matters worse by giving the patient an aggravation. And so for me, it really is a foundation that needs to be in place, and an understanding of how the body eliminates is really central to making these therapies effective and making, addressing chronic disease effectively.
I feel like you're tying in beautifully with my question flow, because my next question is, when is the best time to consider lymphatic drainage support? What are the most striking indications when a patient walks in through your door like, oh, this patient needs lymphatic drainage ASAP?
Yeah, sometimes it's a huge red flag, like the patient has lymphedema or lymphatic swelling, or they've got chronic sore throats or chronic lymph nodes in the neck or the groin or the axilla. Certainly the breast tissue is heavily lymphaticized, just made up a word there.
Nice.
So, anytime there's a breast health concern, you want to be addressing the lymph, but, sometimes those are the more dramatic examples, Mohammed. And really, I use lymphatic support in almost every situation that walks through my door. And I find that, patients that don't necessarily know that they have a lymphatic issue, once you start talking about what it's actually doing and what it does, then the light bulbs start to go on. So let's just back up a little bit for people that might be listening that had no idea why the lymphatic system is so important. So first of all, it's a circulatory system separate from the blood, but it is a circulatory system, but it has no central pump like the heart does, for the blood and blood circulatory system. So it requires these either muscular contractions, so activity and exercise is one of the best ways to keep your lymph flowing, but also there are some subtle intrinsic pumping action in the lymphatics, but it's very subtle. And what it does is it's located superficially underneath the skin, and it really permeates through what is called the extracellular matrix or the interstitium, which is sort of the ground substance in between all the cells. So it's outside of the organs, and it's even outside of the cells of organs and tissues, but it plays a huge role in picking up waste products from all these tissues and moving them through the body and dumping into the gut and then being eliminated. So it plays a huge role in waste management, but it also is the central circulatory system that moves all of our immunoglobulins and immune cells around. So it plays a huge role in immunity. And sometimes, you've already mentioned, and I've already mentioned post-infectious syndromes, whether it be viral, whether it's COVID or other coronaviruses or other viruses like Epstein-Barr and other herpes viruses, bacterial like Lyme and all the co-infections, Bartonella, Ehrlichia, all of those things, or even, metals and biotoxins and mold sensitivity, all of that has to be interfaced with the lymphatic system because it's what triggers our immune response. So if a person has had an infection, say, that can put an extra demand on the lymph. So you can end up with a sluggish lymphatic system because of a prior infectious state. And then conversely, if you have a sluggish lymphatic system, if you're sedentary, if you're not exercising, if you're not moving your lymph, if that just happens to be a weak spot in your system, you are more susceptible to infections because you're not able to move those immunoglobulins around and immune cells to fight off infection. So it really is central in terms of eliminations, detoxification, and immune identity.
And just to clarify for those in the audience that may not have a medical background, immunoglobulins meaning antibodies. So we're talking
Exactly.
antibodies to everything from past infections, even from vaccination, from any type of immune stressor. Really,
Yeah, this is why you get swollen lymph nodes when you have an infection, because those nodes, those little sponges along the vessels, are in active mode of producing antibodies and fighting off, the infectious process and getting your immune system into gear so that you can eliminate whatever pathogen. And of course, people listening that, have had or are concerned about cancer, that's outside of the topic of our conversation. But, obviously cancer cells move through the lymphatic system. And this is why the nodes are tested, and lymph nodes can actually kill cancer cells. So a healthy functioning lymphatic system is also important in terms of cancer prevention or cancer treatment. And this is, obvious in terms of staging or for anybody that's had cancer.
That's so critical. I feel like it makes so much more sense the way you describe it for even patients who are like getting boosters, getting vaccination. Sometimes there is lymphedema. There's
lymph arm. Yeah.
yeah,
It's being
lymph
called lymph
arm.
arm. Yeah.
I've seen that in
Totally.
multiple patients after multiple boosters or vaccinations, and they're worried that it's something bad, but it's actually part of the normal immune response per se.
Absolutely. It's only really problematic if it lasts a long time, or if the body's, ability to reestablish balance and homeostasis isn't met in a reasonable amount of time. And that's really the case for any kind of infection, right?
I feel like, this is such a huge topic and it can be a little bit daunting to kind of cover everything, but maybe it might help to discuss some of the things that don't seem to be effective in terms of detox. So there are people who talk about detox, and then there are others who are starting to get in line with your wave of thinking. They call it pre-tox. So this is kind of the step before that.
Yeah, how I've talked about it a lot in the past and think is just a really worthwhile thing to emphasize is that there is a distinction between what I'm talking about in terms of drainage and helping eliminations and detoxification practices. So drainage is a way to help support the natural physiological healthy functioning of the organism. So that would include, of course, supporting the intestinal tract and making sure the microbiome is in good shape, supporting the lungs. And there's various things we can talk about at the end if you want some more actionable steps, and supporting the kidneys, supporting the skin, which is another organ of elimination, supporting all the mucosal membranes, which are the secondary organs of elimination in the body. Whereas detoxification is more like it's a more aggressive approach in terms of pushing the detox pathways in the liver. So it's like giving high dose nutrients or IV nutrients, or doing like, major herbal remedies to really try to get the body to more forcefully push those detox pathways.
Yeah, like
And
glutathione,
yeah,
NAC,
most people
ALA.
don't really have like, yes, there are the genetic pictures that we can look at with all the cytochrome P450 pathways and SNPs that can occur in people's ability to detox, and that can be helpful. But I think what's a lot more helpful and a lot more foundational is just to naturally help the body eliminate more effectively through a number of various things, not just taking supplements. And then you might, find that a more detoxification heavy protocol might be in order, but you're not going to get the kind of aggravation that you might get with some patients if you're just what I call translocating toxins from one part of the body to another. If you're just like pushing things in deeper or moving it into the lymphatic system without the ability to properly eliminate it, or if the person's constipated, or if their microbiome is hypersensitive to making inflammatory cytokines, or if their lungs are too weak to fully expire, or their kidneys are weak, or what have you, or their skin, you can get a person. This is why you get rashes. This is why you get extreme fatigue and headaches, and a worsening of any of the symptoms that they may have been trying to address in the first place. And
That's
that all can be
yeah.
stimulated pretty easily in the kinds of hypersensitive patients that get the diagnoses of MCAS, or, some of these chronic inflammatory immune mediated conditions.
Yeah, so chronic inflammatory response syndrome, SIRS, that could be from mycotoxin or biotoxin illness, which Schumacher promoted. But there's a spectrum to this, and it may not fall into any one of these labels.
Absolutely.
I feel like it's hard diagnostically and to communicate to others when you see someone, let's say, who has impaired detoxification, who may not respond well to things like glutathione, NAC, some of the things that a lot of people promote that are really good for your liver. But there is this concept that seems to be emergent now in the field of complex chronic illness of slow excretors, people who have impaired detoxification ability. And what you were suggesting, which I find intriguing, is it's not just genetic. It's not just the SNPs. It's not just mutations. It's something else that may not be. It could be epigenetic. It could be something else that's related.
Yeah, it could be just purely body burden. It could be liver stagnation from the Chinese medicine perspective. It could be a dysregulated immune system or dysregulated nervous system, which is so often tied so closely together. And this is why, in my purview, it's not that people have chronic infections or persistent infections. They've just got a signature, a pattern that's locked into the immune system, the nervous system, and sometimes the hormonal system, that makes them unable to respond appropriately to things in the environment or foods that are totally benign. Like I tell people all the time, it's not the food, it's your reaction to the food. There's nothing wrong with a parsnip, right? Like it's not that a parsnip is a problem, but you can react to anything if you've got a dysregulated immune system or nervous system. And that's why the drainage remedies and the low dose immunotherapy, and, basic helping support eliminations. And by this, I mean, yes, like things like exercise and rebounding and moving the body, but also, infrared sauna for people that, and starting out really gently, I use therapeutic baths with various essential oils and Epsom salts and hydrogen peroxide. I'll use certain plasters, like a mustard plaster for the lungs. I'll use castor oil poultices. There are all kinds of things. I just actually spoke to a very, very sensitive patient a couple days ago who was having what she believed was a reaction to the alcohol content in some of the complex homeopathics. And even though it's the ones that I use are made from beet sugar, it's totally benign and it's a very, very minimal dose. It's like what you would get from a ripe banana.
Wow.
So it's really, really, but some people are that sensitive. So I suggested, and I've done this in the past too, but it's been a while, to put it in just the crook of her arm, to put it in her elbow and let the remedies go in through the skin. So, it's, as you said, it's a spectrum,
Mhm.
but really the idea is to harness the body's innate ability to eliminate. And so the lymphatics, the emunctories, the secondary emunctories, all those things have to be working optimally before I think you can use some of these more, intense therapies with good results. That's my patient population. I know that there's lots of other people that, practice differently, but the people that have found me and the people that I work with do better with a much more gentle initial approach. The other thing that can be problematic is the use of, multiple pharmaceuticals. I mean, polypharmacy can be extremely difficult for the body to understand how to manage all of those drugs and eliminate the byproducts of those as well. So, that's a lot of information for a body to do all at once.
So it sounds like your order of priorities to open up the emunctories, right? Opening up the modes of elimination, and then you start, going. What would be like the next step
The
after
next
that?
thing would be to really go into some of the root causes. So identifying for a person whether it is, a mold sensitivity and exposure that's really driving a lot of their symptoms, whether it's a yeast sensitivity, that's a huge one. Everyone's got yeast in their body, everyone's got candida, but some people are extraordinarily sensitive to it. And so you can do all the killing of yeast that you want. I have patients who've been on diflucan or nystatin for months and months and months at a time. And the minute they stop, they're back to itching and brain fog and fatigue and muscle aches and all of this stuff. So it's the yeast sensitivity. So the antifungals are just sort of keeping the load down. But the minute it comes back up, the minute the body has to try to do that on its own, you get symptoms. So that's an immune and a nervous system reaction. So after the emunctories are addressed and hopefully the body is eliminating more effectively and you're working on specific organ systems with specific drainage remedies, excuse me, then you start looking at, is this person affected by a Lyme signature, a mycotoxin signature, a post-viral signature, which of course we're seeing more and more of because millions and millions of people have now been infected with a new novel virus, myself included. So, you have to look at which system is being affected by which type of pathogen. And this is where low dose immunotherapy has really, really come into handy for me, because I think of that as more of the second phase, like the root cause, more of a targeted approach. And for those that don't know what I'm talking about, low dose immunotherapy, which was taught to me by Dr. Ty Vincent, who is again a pioneer in this field and has been doing this for a long time. And he's a medical doctor and trained in allergy medicine. And that's really where this medicine, this modality comes out of. So it's akin, the most simple way to put it, it's akin to like an allergy shot to help the body create more tolerance, but it works much differently because it's not blocking an immune response like an allergy shot does. It's way more, I like to say, in the realm of woo, because it's so diluted. It's like diluted at homeopathic dilutions. But it's not technically homeopathic because it's not succussed, it's not potentized, which is another factor in homeopathic medicine. But it uses different antigens or allergens. So there's a food mix, there's an environmental mix, there's a mold mix for people who I believe have more of a broad allergic response to foods or sensitivity response to foods. But then there's also specific antigens. So of course there's a Lyme mix, there's a yeast mix, there's a Epstein-Barr mix, there's a herpes simplex virus mix. So that's more going after some of the root causes. And I've done that with drainage remedies as well. Like, some of the complex homeopathics that I'll use are going after certain viruses. I love Byron White has herbals, but the doses are not working really through traditional phytotherapy or herbal medicine. It's definitely got a more energetic component. I also use Nutramedic's herbs also have like a really, I think, strong energetic signature. So it's not that I'm only using homeopathics, but what I'm doing is really trying to go after whatever specific antigen or pathogen might have caused some of the disturbance to these, systems, the immune system or the hormonal system. And I've had patients, long before I started using LDI, even that, like Lyme patients. I'm in Connecticut, so, I'm at ground zero for Lyme. And I've had patients, women who've had premature ovarian failure, in their late 30s and early 40s from what I believe was a Lyme or a Bartonella infection. So, it's really impossible to predict how these certain pathogens are going to affect any one individual system. And this is the thing I kept telling people about COVID too, because as naturopaths, I'm sure you as well have had a lot of patients who were really resistant to vaccinating. And, some of the sickest people that I've seen with COVID were people that were not vaccinated. So, you really have to look at things, in my opinion, from a more comprehensive view rather than just, people have gotten so polarized in terms of there's only one way to do things. So any individual, like you might have gotten COVID and not been vaccinated and sailed right through, or you may have had a really horrific time with it, and it does matter your, health status beforehand. But I think I've heard personally a lot of naturopaths and some medical doctors and chiropractors and other practitioners of natural medicine sound really cavalier to me that, that basically, if you're in good health, it's not going to be a long-term problem. Or I have not seen that in my own practice at all.
Yeah, I do agree. It's a spectrum in terms of what your body burden was pre-COVID, and then how that stacks on itself and becomes
Yeah.
a syndrome after COVID.
Yeah.
I found that some of the more common things that really healthy people who come in, even CrossFitters, people who are at the peak of their health, why they're getting sustained symptoms, often it seems to be related to toxins that were established in their body burden. So mycotoxins, mold related toxins, heavy metals is another big topic. Specifically
Yeah. And then of
arsenic.
course, anybody that had ever had what used to just be called chronic fatigue syndrome, a reactivation of Epstein-Barr. We know that's an issue. We know that the virus itself causes neuroinflammation. So even people that, may have had a good level of health, if you've got genetics or epigenetic settings that may predispose you toward neuroinflammatory conditions, that can absolutely be. I mean, one of the things I experienced was interesting was just insomnia. Like I'm not normally somebody that has insomnia, but that was the way COVID, affected my system. So, and I'm in very good health. And I treated during my infection, of course, which I do think helps as well.
I'm intrigued by this concept of the nervous system having such a regulatory effect, even above and beyond the lymphatic system, because it's almost like its own energetic system. It's literally moving electrons, it's moving
Yeah.
ions.
Yeah.
Um, and even,
Hormones and,
yeah,
neurotransmitters are basically hormones of the brain. And we haven't mentioned, but I know you wanted to get into, I haven't mentioned the lymphatics of the brain are called glymphatics because they help drain the toxins from around the glial cells that help support neural cells, lay down myelin. And a lot of this happens during sleep. So when you have insomnia, when you have problems getting a good amount of deep sleep, your detox capacity is compromised just from that.
mhm.
So you could have the perfect genetics for detoxification SNPs, but you could have, a problem with, getting into a deep sleep or low melatonin or high cortisol, which is going to throw off your melatonin. So there's so many different ways that a person's nervous system can get dysregulated, and detox can be impaired.
And you feel that the drainage approach can also address this nervous system dysregulation or this hypersensitivity where, I've had the same experience with patients who react to alcohol, they react to water, they react to,
Yeah.
you can't even put things on their skin. um, and maybe the only thing they can tolerate is something like ozone, because it's so foreign to the body. It's not like something that's naturally produced, that they actually do tolerate ozone at a low
Oh, that's
dose.
interesting. Yeah.
And so that's very interesting. What would be your approach to kind of modulate that nervous system hyperactivity? Because it could be from COVID. The spike protein can do that, but other pathogens do that too, especially
Absolutely.
Bartonella. Um,
Absolutely. Yeah. So, I mean, it's really the same concept applied to every part of the body, which is when you help the body eliminate toxic waste products, or not even toxic waste products, normal waste products of physiological function. So you don't even have to be exposed to any of these toxins, biotoxins or heavy metals or any of it. If your body isn't eliminating the normal byproducts of metabolism, then you can get into symptomatic territory as well. So if you help the body eliminate more effectively, you basically let the tissues on the cellular level all the way up to the organ system level function more effectively. You can help the body with its own homeostatic mechanisms, pH, temperature regulation, all of these homeostatic mechanisms that we have, all the hormone feedback loops, all the neurotransmitter feedback loops, all of that can be affected by just simply helping the body's cellular level function work more adequately. But then, in terms of specifics for neuroinflammation and for the brain, I think that yes, I always want to make sure that the synapses are firing correctly, the electrolytes are working correctly, the blood brain barrier isn't leaky, the gut brain barrier, there's all these like more gross things to do. But then also working with techniques like, I really like Dr. Gupta's program. I like it better than some of the other nervous system down training programs. I find his approach, for those of you that don't know, there's a number of different programs that are called like desensitization, neuro retraining, that kind of thing. And it's based on the idea that your limbic system is kind of caught in a loop, like there's a signature of hypersensitivity in the nervous system. And so it hyper reacts to everything. And obviously that can be very closely related to trauma and traumatic experiences, but stressors of any kind, including a lot of these pathogens we're talking about, can stress the nervous system that way as well. So I very often refer people to those kinds of programs. Like I said, I really like Dr. Gupta's program because I find that Some of the other programs, it's more about removing yourself from any kind of stressor. And I don't know about you, but I find life is going to throw stress at you no matter what.
It's about resilience. Yeah.
So yeah, absolutely. So developing resilience, and I find his program to be especially beneficial for that. Excuse me, I have to take a sip of water.
No, take your time. Yeah, and I feel like that's a very critical aspect of making your body feel safe and addressing the limbic system, which is
Yes.
just a reptilian part of your brain that's
Yeah, and that can go
designed.
off from
Yeah,
anything. And
yeah,
the other thing that I really love and have recommended a lot of patients to do is EFT work, which is emotional freedom technique, tapping. Some people know it as tapping. That can also just really down regulate, when you're exposed to triggers, because we're all going to be exposed to triggers. I mean, we're living in 2022 and a global, not just the after effects of a pandemic, but political strife and
exactly.
climate
And
apocalypse.
it's an
And
ever changing
yeah,
pathogen too. It's constantly mutating. It's not something that's ended. It's not going to be eradicated anytime soon. So we do have to find a way to become resilient and adapt. So
exactly.
these techniques are really critical. What have been some of the tools you've used, let's say in drainage or other, homeopathics, etc., in the post-COVID era or the post-viral long haulers era, especially a lot of the folks who get dysautonomic symptoms, which you mentioned could
Yeah.
be dysregulation in heart rate,
Yeah.
dysregulation in blood pressure,
Yeah.
dizziness, etc., palpitations. What have you found to be helpful? And that could even happen after vaccines or etc. Like, what have
Yeah,
you found to
absolutely.
work, and what would be your
Well,
approach?
it's tough. I'm not going to say, I mean, some people I've had better success with than others. I've got a few long haulers that have had a really, really rough go of it. But it is all related. Well, a lot of it's related to the circulatory issues that you mentioned, the dysautonomia, the POTS, the lightheadedness, the blood pressure dysregulation. So doing a lot of, and that includes lymphatic circulation as well. So doing all the basic things that I mentioned in terms of lymphatic support, exercise tolerance is usually quite impaired. So really working slowly and carefully, getting people moving again, because the longer you're sedentary, the more your mitochondria are going to go to sleep, the more inability you will have to get back to a place of resilience. So obviously high intensity exercise is out of the question for a lot
Yeah.
of people. But even just moderate things like walking, but also using drainage remedies specifically for the brain and the nervous system. I use a couple that I find really, really beneficial. And those are mostly complex homeopathics, but I also use, phytotherapy as well. I use things like ginkgo. I use things like compression socks, even for improving circulation. I have people doing, if you can have access to PEMF, which is pulsed electromagnetic
Mhm.
forces. I have a beamer machine, and for anybody that comes and sees me in person, which is only, maybe about 25% of my patients nowadays, I do mostly telemedicine. Um, I put them on the PEMF mat, or there's some lesser expensive ones that people have gotten at home. So that can absolutely help move the circulation of both of lymph and of blood.
Mhm.
Um,
Have you heard of the more manual machines like Flowpresso? They're kind of like or Normatec
yeah,
is used more for athletes, but they're kind of like these full compression boots that you cover over the legs. But Flowpresso, I know
yeah, I've
Kelly's
heard.
work.
Yeah, Kelly Kennedy does a
Yeah,
lot of work with Flowpresso. Yeah, I have no personal experience with them, but Kelly is a friend and a colleague, and I trust that her work is making an impact in people's lives and beneficial. So yeah, a lot of times it's a matter of resources and people's ability to have access to these things. So even something that's free is yoga. So you can
Yeah.
do, lymphatic specific yoga moves for lymphatic flow, for circulation, even something as simple as legs up the wall, where you're just laying and creating that pumping action that once you stand up, your lymph is going to go to work. Even isometric exercise, if somebody can't do a whole lot of cardio, if that creates breathing problems or muscle fatigue, you can do just simple isometric exercises that can stimulate lymphatic flow and circulation as well.
You've also mentioned rebounding, right? Something
Yeah,
called.
rebounding is particularly beneficial for lymphatics. There was a study, it's probably had been, more than a decade ago now, about breast cancer prevention and rebounding, that like 5 minutes a day can, lower your risk for breast cancer significantly. And I'm sure that has to do with the effect of moving the lymph. And as I said earlier, the breast tissue is susceptible to toxicity because there's a lot of fat in the breast and there's a lot of lymph. So these fat soluble toxins that get stored away in the breast tissue can create inflammatory situations where, that can lead to cancer cells. For some, some of it's genetic and some of it's a little more.
What exactly is rebound for people who don't know what that is?
Oh, so it's like a mini trampoline, like any kind
Mm-hmm.
of like rebounding is, when you create the muscle contraction by bouncing on a
Mm-hmm.
trampoline.
There
Yeah,
seems to
yeah.
be so many iterations of that, like there are vibration boards, like whole
Yeah,
body
there's vibration boards.
vibration.
Yeah. Yeah.
Yeah,
Yeah, I'd love to see some studies behind that. I don't know of any. There probably are some out there. Like I said, I have a Beamer, so that's a PEMF unit. Um, so I've looked into the research behind that, but I haven't looked at the vibrational boards. But I'm sure some of those are more accessible too. I'm sure they're more affordable than some of the more expensive PEMF units. And I believe the Flowpresso is a few $1,000s as well. So
sure.
it's out of some people's reach. But then also, supporting circulation, but also just working with antivirals can be wonderful too. And there's, all kinds of immune support, with nutritionals, but also herbals. I really love some of the Byron White products in particular for antiviral approach, and those have to be used carefully. You can definitely overdose and get an aggravation on those. And when I say overdose, I don't mean it in the traditional sense. I always
Yeah.
scare people. Yeah, you're not going to kill
The like
yourself, but
die
you're going to get
off.
an
Yeah.
aggravation. Yeah, yeah, die off, or just creating that mobilization of the toxins that then is going to trigger the immune system and the nervous system. Um, so yeah, so I use a lot of those products as well, and I've also used the LDI a lot. There's a upper respiratory mix that I've used for post COVID. There's an Epstein-Barr mix that I haven't seen as much benefit with as some of the other things, but even as I said earlier, it's hard to predict how this virus is going to communicate with other viruses that might be latent in the body, or other conditions like chronic Lyme or Bartonella or other things that, might tip the balance. So depending on each person's symptom picture, I might use either, an allergy mix or an antigen mix for the.
And is are those mixes something that you make from the patient's own fluids, or because I know
You
there are ways in isopathy and homeopathy to use succussed urine, succussed blood. How is low dose immunotherapy different from that?
Well, I get my antigens from Dr. Vincent, who has his company is called Global Immunotherapy, so you can look them up. Um, but you can also do autologous LDI preparations from stool, from saliva, from lung secretions, etc. I haven't done that yet just because I haven't found the need for it. I'm getting good results with the combination of drainage and helping people eliminate, and then using the more targeted either complex homeopathics or herbs or elimination methods or detoxification methods for specific problems for people.
That's awesome. I know you mentioned you wanted me to hark back on something you mentioned in the beginning about lung support for COVID. You said there were a few things that you wanted to touch on.
Yeah, I mean the LDI is definitely important. I mean there is an upper respiratory mix that I've used, but also things like plasters and poultices of various types. You have to be careful with a mustard plaster because it can get kind of warm and hot. So people with skin issues, sensitive skin, may want to do that under the supervision of somebody. But also IR sauna is great. That's really going to be beneficial for the whole system. But I find that a lot of people with chronic lung issues do really well with the IR sauna. And, that's because it's not just opening the pores and helping you sweat, which is a beneficial thing in and of itself, but it's really helping upregulate heat shock proteins, which are inside the cell, molecules inside the cell that will then sort of scarf up misfolded proteins and help the body really come back to a place of homeostasis from a much deeper level. And the IR saunas penetrate about 1.5 inches into the subcutaneous fat layer. So it's really getting at some of those, as I mentioned earlier, fat soluble toxins that may be a little bit more difficult. And I find sometimes, the lungs are a deep organ. They interface with the outside world, but sometimes it's harder to get at the lung eliminations than it is, say, to do a detox or elimination support for the gut. So there are specific complex homeopathics too that I use for the lungs. And then there's wonderful, wonderful herbal formulas for the lungs as well. One of the things that I use really effectively is a Chinese medicine formula that Physica Energetics makes called Temple Warrior. And I used it when I was sick with COVID. And I didn't get super sick, thankfully, but I've also used it for years for any kind of lung issues, for helping support eliminations for the lungs. And that's been really a great product for me personally in my practice.
That's awesome. Have you found nebulizing works with these
Yeah,
products?
people, well, I don't have people nebulize the products, but I have had people to use the nebulizer for glutathione, of course.
Okay.
And I also, I'm working with a compounding pharmacy. I'm really hoping that I can get this going, but I'm working on creating some customized nasal sprays as well, using things like EDTA and other support for the sinuses, because I didn't talk about this earlier, but when the primary emunctories are overwhelmed, the liver or the gut or the kidney or lung is not working adequately enough, sometimes the body will compensate by using the mucosal membranes to try to eliminate. So that's the sinuses or the vaginal tract in women, or the skin, or like chronic otitis media. So sometimes this is the place that you really need to address the eliminations and really help those secondary emunctories clear so that the primary emunctories can sort of take over the job.
Interesting. Does this segue into the concept of biofilm formation? Is that how this potentially
Well, that's
happens?
interesting. Yeah, I mean, I think the nasal sprays definitely would be addressing biofilms. Biofilms are, for those listening that don't know, ways that bacteria create a protective coating against themselves and sort of turn their antigenic substances inward so the immune system can't recognize them and eliminate them effectively. So, for biofilms, you may want to do, if you suspect a person has, and we all have biofilms. It's like, how much are they impacting your health? So, things like lumbrokinase and nattokinase and high dose proteolytic enzymes can help break down that protein coating and expose.
Yeah.
EDTA, exactly. Frankincense essential oil. There's some other, really interesting ways to try to come at biofilms. Again, I would say caveat, this is the kind of situation, if you start going after biofilms, but if you're emunctories aren't working properly and you're not draining properly, and you start to get exposure of those toxins or the frank pathogens, if you still have an actual infection, then you could get a lot worse before you are able to overcome the infection again. So just be careful with that.
This, this is so prevalent in complex chronic illness in terms of mitigating the side effects of treatments, unfortunately, because the concept of die off is very nebulous to so many. There's no way to quantify it. I feel like many things can cause die off. Ripping open biofilms with standard treatments, even ozone, killing mold, because mold, when it gets killed by any fungals, releases more toxins, more mycotoxins.
Absolutely.
So, like you
And
mentioned,
just traditional antibiotics, we know people
yeah.
can have tremendous reactions to antibiotic therapy.
Do you feel that drainage can help for die off? Do you feel like that's something that can help mitigate the side effects?
Yeah, I mean, so that's the whole idea, is that the drainage is gentle enough that you shouldn't get an aggravation. That's what I'm attempting to do, is just work on the body's natural physiological function before I would go after killing anything. And this is why LDI made so much sense to me right out of the gate too. I mean, I've only been using this therapy for about 5 years now. Um, and that, really can make a huge difference. If you've got healthy drainage pathways, then you should be less likely to have a reaction. But when people do, I mean, it's inevitable. Some people are going to have an aggravation. That's exactly what I do, is just try to support the emunctories to get rid of the circulating toxin more effectively.
So it's almost like you have to sensitize the body first before approaching some of the more invasive therapies, so that they, if they do experience die off, their nerve, their emunctories, things are open, they're more sensitized to it. Is that kind of the way?
Yeah, I mean, sensitize, or you could say it desensitize. So you have to
desensitize.
Yeah. Because I think the sensitivity is the hyperreactivity of these various systems. So yeah. So it's always a bummer when I aggravate somebody, but over the years it has happened, and you just have to try to get through it as quickly as possible, and hope the patient doesn't get scared off and think they're going to get worse with every intervention, because there are those folks that have been so sick for so long, and they've just given up hope that there's any chance of getting back to balance without going through hell. So I definitely respect people's needs in that area, and I have a lot of really, really sensitive patients.
That's really helpful to know for those listening, that there are options and there is a way and there is a road to recovery. I feel the body does have an innate ability to heal. If you just look at the anatomy of a person, it's called a neurovascular bundle. You have lymphs, arteries, nerves, they're all there together. They're part of a holistic system. And I feel this is a very critical step. I often say it's the missing link in therapy, is to discuss the emunctories, to discuss drainage, and that further can help lay the foundation for tolerating more invasive therapies that may or may not be warranted, but really this is kind
and
of
in some cases they
step.
absolutely are. Exactly. Yeah. Well, it's been great talking to you.
Thank you, Dr. Nash. This has been a very elucidating podcast. You illuminated a lot of critical concepts. We thank you for your time. Do you have any last minute things you want to convey to the audience, how they can find these therapies that you've talked about? How can they find you?
Yeah, well, my website is just my name, Ginger Nash, and there's a couple of spots where you can sign up either for my newsletter. There's a spot if you happen to be a practitioner of natural medicine of any kind. There's a spot to sign up if you want to get more information about the course that I'm going to be teaching. It is going to be case-based learning. It's going to be small. I really want practitioners who are active bringing their cases and discussing and learning from each other. But I'll also be covering a lot of these philosophical concepts and the way to move your patients gently through some of these therapies and get them to a place of better balance and health. So I'm really excited. It's been a long time in the works. You've been a great cheerleader for me along the way, and I promise it's going to happen in 2023.
Awesome.
So,
Awesome.
so I'm really excited about that. So, and if you go to my website, you can also just email me through my website if you have any more questions.
That's awesome. Once again, this is another great episode of the Anatara Medicine podcast, bringing you some of the most innovative advances in medicine and how to treat complex chronic illness. Dr. Nash, thank you for your time.
Thank you so much to have so much fun to be here.
Thank you. Take care.
Yep.
Bye bye.